Well, hello, I'm Kim Best, and I have a guest with me today. I'd like to give a little bit of background on the guest. Jen is an emergency nurse, and you have worked in the emergency room for how many years now?
Probably close to 14.
Oh my gosh, that's a long time. Well, I just want to say that Jen and I are both wearing green shirts. And I know Jen very well because she is my daughter. And as all of you know, I spent quite a bit of time as an ER nurse myself. So Jen became an ER nurse. And well, let me give you a little more background. Jen's first background was in international business, and she traversed the world on a party job for a while, and then realized there wasn't a huge future in a bachelor's degree in international business. So she went to nursing school, recognizing that there would always be a job in nursing. Um, she did not at that time plan to follow in her mom's footsteps. As a matter of fact, what happened was right from nursing school, she said, I'm going into the ER. And I'm like, no, you're not. You have to earn your way into ER doing the kinds of things the rest of us do. Floor nursing, in my case, oncology. And you don't tell Jen no to anything, she's going to find a way. So she did get an internship in the ER. Is that right? An internship is what that?
It was a graduate nursing position. So it was an
Yeah.
extended, basically, preceptorship. It was 6 months long.
And she went right into the ER. So she did it. I'm not at all resentful that I had to take the long way and she found a shortcut. I promise. But it's interesting because the one thing with me working in conflict management and Jen in the ER and even talking to other nurses and healthcare professionals, things have not changed in how healthcare manages conflict, nor has the nursing experience in terms of turnover being high, feeling like you're supported being low, being able to manage conflict, being a skill that's not taught well. And and the truth is it's even gotten worse, right? So we've had this long-term problem. I was 1980 when I graduated. Um, And it's still a problem that hasn't gotten better in all that time. It's gotten worse. Now, Jen, before I start asking you questions, I just want to say Jen and I did not prepare for this. So I'm going to blindside her a little bit here because I love her that much. But I prepare when I talk with someone. And I recently, a few months back, spoke with the Missouri Nursing Association, and I did something called the Healthcare Conflict Shit Show. And I talked about the statistics for healthcare conflict, how it affected nursing and hospitals and patients, and then the things that actually showed us that worked for resolving conflict and reducing things like patient errors, um, recidivism, all the things that unaddressed conflict contributes to. So I wanted to update that and see if it was still current. And I found out we're in Missouri. I found out Missouri recently, as in 5 days ago, uh, released a study about the state of conflict in nursing. So this is, Jen, this is your reality, right? 90% of Missouri nurses reported verbal abuse. What do you think of that?
Easily.
I don't know where the other 10% work.
Right.
I don't know. I don't know. Probably maybe I don't in lab or something. 63% of Missouri nurses reported physical violence.
I'm surprised that's not higher.
Boy, that's a lot for physical violence, right? Physical violence. That's crazy.
Mhm.
46% of Missouri nurses considered leaving their job multiple times due to workplace violence. Comment.
I mean, again, it's not surprising.
Well, we've had lots of conversations, and I remember too, it's like, oh, this is just too hard. I can't do this. The burnout, right? The burnout that's part of that. But I know that's a conversation you've had, and even some recent data showing how nurses feel trapped. Can you speak to that at all?
Um, Trapped as far as like trapped in the job.
Hmm.
Yeah, I think that, as a nurse, they say that there is a lot of opportunity for nursing positions. It's true. But within those nursing positions, you still face the same types of pressures and situations. So I could work in an urgent care, I could work in an oncology clinic, I could work, wherever, and you're still going to come in contact with the violence and the verbal abuse and the burnout and things like that. So I think you feel trapped because you have this 4-year degree and you went into nursing to help people for the most part, and now you're stuck there because no matter what position that you go to, you're still going to have the same problems.
Yeah, that's a great point. That's a great point. So, continuing with the Missouri data, 7,762 workplace violence incidents reported by 65 Missouri hospitals in 2023, which meant an average of 21 incidents per day across Missouri. 21 incidences of workplace violence per day. That's crazy.
Again, I thought that number would be higher. I mean,
Oh,
considering
that's a
how,
lot. Yeah.
in
Yeah.
consideration to how many nurses there are, how many hospital facilities, how many,
Yeah. Here's a statistic that we already know that I talk about. So it costs 61,000, depending on where, roughly $60,000 to replace one staff nurse in Missouri. That was previously around $56,000. Obviously, it goes up, but what you can't put a price in is losing institutional knowledge. Like you might be able to bring in another nurse, pay another $61,000, but you don't have somebody who understands the system, who understands nursing, maybe new hires as well, the experience. Yeah. So does that surprise you, that number that it costs to replace a nurse?
no, it doesn't at all. And you'll find, or I have found, that even the newer nurses with 1 year or less of experience are also struggling with the job in their first year. And as we know, the first year is usually really tough,
Mhm.
but you're kind of thrown into a situation that you didn't expect. And it's it's hard to keep those people in the positions because the job is so hard. And then, like you said, the turnover and the burnout rate is very high right now.
Yeah, I don't have those statistics exactly in front of me right now, but the truth is, you are 100% right, and there's a huge number that don't last a full year. But the highest incidence of experience that those new grads and nursing students experience the conflict from are other nurses. It's not the patients. And this is why sometimes I hear nurses say that we're eating our young. I've heard that expression for years. We're eating our young. Okay, that may be true, but what are we doing about it? Are we giving people the tools they need to resolve conflict that you don't have to eat somebody, even though you're working in a stressful environment? Have you learned ways to communicate or to fix things when they break? I mean, we all snap sometimes, right? Like, or am
And I
I the
think
only one? Am
itself
I the only one that gets triggered?
I think the system itself is also set up in a way that's not like, I mean, the floor staff is always fighting with the ER staff. The ER staff is always fighting with the floor staff. It's always a back and forth. It always has been. It's not a system that operates very well to begin with.
It's a culture.
Hmm.
Yeah, you're not wrong. You're exactly right. It would take rebuilding the culture.
Hmm.
Yeah. And re-seeing the need for people's work. I mean, I experienced this as, it's a big system, a hospital system. And just like a family system, It gets used to working a certain way. And in the absence of change, it just anything new coming into the system feeds that again, which that whole system thing is another problem for hospitals because every single time you can't hit a stable system if you have constantly people coming in and then the system changing again, right? You can never get a level of stability without having a plan for how you're going to equip people into a culture with skill sets that help them mitigate for the things that disrupt the system.
Right.
Did that make sense?
Yeah, absolutely.
Okay, good. Yeah. Yeah, that's a great point you just made. And then of course, the more the workplace violence in the past year, the more predictability for nurses that they intend to leave their job or even the entire nursing profession. And I've had lots of nurses say, I'm looking for something outside to do. I've seen a lot of nurses doing that, and I've seen more and more nurses moving into things like conflict management and conflict management training as an alternative to actually working in nursing. The problem is, has anybody ever, ever, ever offered you conflict management training, Jen?
You,
That's a fact. I wasn't expecting that answer, but thank you very much. Yeah.
like at the
Yeah.
workplace,
Go ahead.
no, I just said at the workplace, no.
Yeah, at the workplace, no. And I want to say too that I can promise you that you can do the 1 hour continuing education, mandatory something on the computer at work, and you're going to come away zero better for that. That's my promise to you. Because the skill sets uh just require more learning and practice than that.
I think like anything, it's a muscle memory thing.
It
The more
is.
you do it, the more you know what to do.
Yeah. And the more how to do it. So I think of it as tools in the toolbox for conflict management. The more tools you have, you pick out this tool and try to unlock it, and nope, that didn't work, but I got something else to fall back on. And the one thing I really do believe for working in conflict for a long time is one of the things is separating the people from the problem. Like we tend to say, oh, Jen's a problem. She's always got to get her way. Not that anybody's ever said that about you, Jen. I'm serious. But we can't solve for Jen, right? So if Jen's problem is she doesn't share her toys well, that's a problem we can have a conversation to resolve. But until we understand the conflict dynamics, it's really hard to just tell people, well, you need to do this. You have to understand like why we do what we do and then have more tools to be able to have those honest conversations so people can choose a better way forward. Not you tell them a better way, but they can actually choose it.
And I think it's back to the system too. I might have those skills. I'm learning those skills. I might be learning those skills, but unless the people surrounding me are also learning those skills, then I think it needs to be again back to the system.
Yeah. And you raise a great point because the truth is, I don't know if you know this, but your mama wrote an article that got published in the Austro-Asian Journal of Dispute Resolution on healthcare coaching and the system. And in systems, especially in your unit, there's obviously not in a whole hospital. So your hospital, everywhere you work, is made up of multiple systems and one big system. So an emergency department is one system on its own. And what works for X-ray isn't going to work in the emergency department. People design their own conflict management system within that. The numbers of how many people does it take for a system to change? Does everybody have to be trained for the system to change? Well, for it to do it more quickly and for everybody to understand what's going on, sure, that's fantastic. But the truth is, one person can change a system, not a hospital system. Obviously, it's too big. What happens, I'll use a family system, say there's a group of 5 or 6. Again, we're functioning the same way all the time. Everybody knows their roles and their rules. One person changes that, the system's going to change. This is science. The problem is first, before it changes, everybody's going to double down on trying to get you back to your role in the system because it's reluctant to change. I put a quote that was just so powerful. It is, even, I can't say the exact quote, but even if our lives depend on it, we will double down on what we're doing that's not working because we're so resistant to change. We do that. Like, how smart is that?
Me
But if
more than
one,
most.
go ahead.
I said me more than most.
I love you so much. But the truth is, one person changing and holding on to that change, what happens is people will begin to learn those skills. That is not an efficient way to do it. And the truth is, time's running out. Like time's running out. Part of my article, and well, let me ask you this because I think it's um, your best guess of why things are getting worse instead of better in terms of violence being up toward healthcare workers, basic overall incivility, feeling less safe because of how things are for healthcare workers themselves. So what do you think is the root of this?
I think it's a culture thing. I think these days, everybody wants instant gratification, even when it comes to ER nursing. A patient comes in, and yes, they still have to wait in the waiting room sometimes, most of the time. Sometimes it can be multiple hours. They're there because they don't feel well anyway. But people don't like waiting, first of all. So that's hard, especially when they're not feeling well, like I said. Um, and I think in general, I don't want to say this country, but people these days want results right away. And that is not necessarily going to happen. So I think that's one big problem. Um, Obviously, there's more.
I'm going to call that one unrealistic expectations.
Right.
And definitely that's huge in a whole conversation in healthcare. The irony is, this is just the irony of this. It's a bit stunning. So there's misinformation and disinformation. Trust for nurses. Nurses were one of the most trusted professions in the country. That's gone down because of medical misinformation and disinformation. Nobody knows who to trust anymore, for starters. Um, but we all need healthcare because our very lives depend on it. So if we're mean to the people who are serving us, I like the laugh, and they quit because we're not treating them well or being collaborative in our healthcare because we're treating them. I mean, I remember thinking it's a service. Being a nurse is a service, like as in I am a servant. Um,
Sometimes
so
I liken my job to being a waitress.
yeah,
I'm
I always
a
did
server
too.
restaurant.
I mean, I don't disagree with you at all, and I don't have a problem with that. But if you can't treat me well, it makes my job that much harder. Now, given people's lives depend on us having some kind of a good relationship, are people not treating healthcare workers ultimately just only hurting themselves? I mean, not treating healthcare workers well. And the same with, incivility the other way too. It's a two-way street, right? If somebody comes in treating you badly, it's hard to bring your best self to the whole thing. So just a reset. I mean, I think we need a conversation on now, wait a minute, we're supposed to all be on the same team, and that is your well-being and my well-being, not yours or mine, but yours and mine. And how can we do that? And certainly the unrealistic expectations, it is no, you're not going to live forever. Quality of life matters. Healthcare can't fix everything that walks in the door and can't do it as quickly as somehow you thought we should do it, right?
And not every ER room has a TV. I'm sorry.
And that, ditto that for sure. Yes, yes. I thought we would have maybe a 15 or 20-minute conversation, but I really feel like we could do this for days. So what I'm going to do is stop it here. I don't really even have time to go into all the conflict management solutions that work, but I'd like to invite you back another time and see if we end up wearing the same color shirt that time because we did not plan that. Yeah. And I want to thank you and thank you for hanging in there because I just want to say I've talked you off the I'm leaving ledge a couple times, hopefully through empathizing that, yeah, this is super hard. Um, and your competitive nature, hey, if mom could hang in there, maybe I can too. Right.
Right.
Aw, thanks, Jen.
Right. I love you.